Hello everyone, I am Ms. Domapias, Regent Catherine L, and I will be discussing all about trisomy 21. So what is trisomy 21? This is a common chromosome disorder, often called Down syndrome. This is due to an extra chromosome number 21, hence the name itself trisomy 21. For males, it's the 47XY21 plus, and for females, it's the 47XX21 plus. So typically, a baby is born with 46 chromosomes. Babies with Down syndrome have an extra copy of one of these chromosomes, which is the chromosome 21. The extra copy changes how the baby's body and brain develop, which can cause both mental and physical challenges for the baby. So what causes Down syndrome? So the causes of Down syndrome or trisomy 21. As we all know, human cells normally contain 23 pairs of chromosomes. One chromosome in each pair comes from your father, the other one is from your mother. Trisomy 21 or Down syndrome results when abnormal cell division involving chromosome 21 occurs, and this error in cell division is called non-disjunction. So the cause of trisomy 21 is non-disjunction. The definition of non-disjunction is that this results in an embryo with 3 copies of chromosomes 21 instead of the usual 2. Prior or at conception, a pair of 21st chromosomes in either the sperm or the egg fails to separate, passing on both copies of the 21st chromosome instead of the typical one. As the embryo develops, the extra chromosome is replicated in every cell of the body. So what are the risk factors of trisomy 21? So first we have the age, second genetics, third we have race. Age. In women who are older than 35 years of age, the incidence is as high as 1 in 100 live births. A woman's chances of giving birth to a child with Down syndrome increase with age because older eggs have a greater risk of improper chromosome division. However, most children with Down syndrome are born to women under age 35 because younger women, have far more babies. Genetics. Being carriers of the genetic translocation for Down syndrome. So both men and women can pass the genetic translocation for Down syndrome onto their children. Next, we have race. It occurs slightly more often in Caucasian than in African American, although incidence does not vary with socio-economic class. So we have 3 types of Down syndrome. First, we're going to talk about trisomy 21, which this is by far the most common type, where every cell in the body has 3 copies of chromosomes 21 instead of 2. This is caused by abnormal cell division during the development of the sperm cell or the egg cell, which is the non-disjunction. Next, we have translocation Down syndrome. In this type, each cell has part of an extra chromosome 21 or an entirely extra one, but it is attached or translocated, usually in chromosome 14, to another chromosome instead of being on its own before or at conception. And the third, we have the mosaic Down syndrome. So this is the rarest type where only some cells have an extra chromosome 21. There are a mixture of 2 types of cells, some containing the usual 46 chromosomes and some containing 47. Those cells with 47 chromosomes contain an extra chromosome 21. This mosaic of normal and abnormal cells is caused by abnormal cell division after fertilization. So I have a summary for the disease process of trisomy 21. So what causes trisomy 21? It is caused by the abnormal cell division during the development of the sperm cell or the egg cell. After that, there's this three type of Down syndrome. I separated it for non-disjunction or the trisomy 21 itself, failure of homologous chromosomes or sister chromatids to separate properly during cell division. For the Robertsonian translocation or the translocation Down syndrome, a certain type of a chromosome becomes attached to another. And for the mosaic Down syndrome, mitotic disjunction during early embryonic development of normal zygote. And the next, chromosomal abnormalities in the neonate resulting to dysmorphic features and organ anomalies seen in a Down syndrome child. Risk assessments. So we have two risk assessments. Early treatment programs can help improve skills that these may include speech therapy, physical therapy, occupational therapy, and educational therapy. We can also have physical exam from head to toe. Next, we have the signs and symptoms of trisomy 21. I separated three features: the physical features, the cognitive features, and other features. So the physical features of trisomy 21. The nose is broad and flat. The eyelids have an extra fold of tissue at the inner canthus or an epicanthal fold, and the palpebral fissure opening between the eyelids tends to slant laterally upward. The iris of the eye may have white specks called brush-filled spots. Tongue is apt to protrude from the mouth because the oral cavity is smaller than usual. And then the ears may be low set. The muscle tone is poor, giving the newborn a rag doll appearance, and this is also called hypotonia. Fingers are short and thick. Little finger is often curved inward. There may be a wide space between the first and second toes and between the first and second fingers. And lastly, we have the palm of the hand shows a peculiar crease, a simian line, or a single horizontal crease rather than the usual three creases in the palm. And it is all shown, you can all see that in the picture. Next, the cognitive features. Child with Down syndrome are usually cognitively challenged to some degree. The challenge can range from an IQ of 50 to 70 to a child who is profoundly affected, IQ less than 20. The extent of the cognitive challenge is not evident at birth, but the fact that the brain is not developing well is usually evidenced by a head size smaller than the 10th or 20th percentile at well-child healthcare visits. So we have other features. First, we have congenital heart disease, especially an atrioventricular defect. We have stenosis of the duodenum, strabismus, and cataract disorders. They may also have hearing and vision impairments, altered immune function because as these children grow, they are prone to upper respiratory tract infection. We also have acute lymphocytic leukemia. This is probably due to a second gene aberration. They tend to develop this condition about 20 times more frequently than the general population. And the most common one, more likely to develop Alzheimer's disease. And based on a study, more than 75% of those over age 60 are affected with the disease. We also have to take note that even if children are born without an accompanying disorder, their lifespan usually is limited to only 50 to 60 years because aging seems to occur faster than usual. In spite of modern medical developments, life expectancy is still shortened, with 20% dying in the first decade and 50% by age 60 years old. So what are the diagnostic tests for trisomy 21? So if the screening tests are positive or high risk for Down syndrome, further testing might be needed. Diagnostic tests can provide a definitive diagnosis with almost 100% accuracy. First, we can do amniocentesis. It is most often used to detect Down syndrome and other chromosomal abnormalities. So this examines the amniotic fluid and is usually performed after week 15. Next, we have the CVS. It can provide information about your baby's genetic makeup. It can reveal whether a baby has a chromosomal condition and other genetic conditions. It also this examines the material from the placenta and is usually performed between the 9th and 14th week. Next, we have the percutaneous umbilical blood sampling. It is used to detect certain genetic disorders, blood conditions, and infections. So this examines blood from the umbilical cord and is performed after week 18. So I have here 3 nursing diagnoses for trisomy 21. First, we have imbalanced nutrition, less than body requirements, related to difficulty feeding due to tongue far and high palate. So children with Down syndrome can encounter problems with feeding or swallowing due to physical, medical, or behavioral issues associated with their condition. Low muscle tone, sensory problems, food refusal, low endurance, physical features, or issues with oral motor skill development can all lead to problems that make eating difficult. That's why I made it the top priority. Second, we have the self-care deficit related to motor and cognitive impairment as evidenced by difficulty in achieving ADLs. Children with Down syndrome have or are presented with impairment in the area of fine motor skills, which interferes with activities such as handling of locks, opening, closing of faucets, use of utensils, and other activities of daily living. Next, we have risk for infection related to decreased muscle tone and poor drainage of mucus. So Down syndrome individuals may have a high frequency of infections, usually of the upper respiratory tract, characterized by increased severity and prolonged course of disease, which are partially attributed to defects of the immune system. These immunological abnormalities will increase the risk of infections to the individual, hence require further assessment and care process. So what are the nursing management for trisomy 21? So number 1, closely monitor nutrition and assess the ability to feed. This is to ensure clients adequate nutrition and to be able to identify the client's capability to eat. Next, provide adequate nutrition. This is to ensure the needed health diet and body requirement of the client and to improve the well-being of the client. Third, encourage parents to swaddle the infant or wrap him or her tightly in a blanket before picking up the infant. This is to provide security and warmth. When feeding infants and young children, use a small straight-handled spoon to push food to the side and back of the mouth. This is to properly feed the client since feeding difficulties occur due to a protruding tongue and hypotonia. Next, clearing the nose with a bulb syringe using a cool mist vaporizer. This is to prevent further complications since they are prone to respiratory infections. So next, increase fluid intake and encourage foods rich in fiber. Constipation results from decreased muscle tone, which affects gastric motility. Next, provide good skin care. Since the skin of the client is dry and prone to infection, it involves minimum use of soap and application of lubricants. Apply lip balm to the lips, especially when the child is outdoors, to prevent excessive chapping. Next, we have provide, teach, and encourage the proper hand washing technique. This is to promote the principle of microbiology and to prevent from infections and further complications. Proper disposal of soiled objects such as tissues, linens, and etc. This is to avoid the exposure of infection. Next, carefully position children or change infants' position frequently, since they have generalized laxity of joint ligaments and their muscle tone is poor. Next, if antibiotics or any medications are prescribed, educate parents to take the full course of the medication. This helps their immune system and aids in fighting against infections. We can refer client and his or her significant other to the following: speech therapy to improve the ability to socialize and communicate, physical therapy to help strengthen muscles and improve motor skills, occupational therapy to help refine motor skills and make daily tasks easier, behavioral therapy to help manage the emotional challenges that may accompany Down syndrome, and genetic counseling to raise awareness and be able to help the significant other understand the situation. Next, discuss with parents their feelings concerning attachment to the child. Emphasizing the child's lack of clinging or molding is a physical characteristic and not a sign of detachment or rejection. Educate the parents about Down syndrome. Many parents find that learning as much as they can about Down syndrome helps ease some of their fears. Assist the family in preventing physical problems and the care of a child with the disease. This is to facilitate adjustments related to their behaviors and treatment towards these individuals. And lastly, of course, we have to support the family. The client and the family need support during these trying times. They need strong support and guidance from the time the child is born. So, what are the medical interventions or management for trisomy 21? We have to take note that there is no medical cure for Down syndrome. However, clients can benefit from early detection and medical assistance in order to develop necessary interventions and future actions. So we can have prenatal testing and ultrasound. Prenatal testing or screening can estimate the chance of a fetus having Down syndrome. This can able to detect problems as early as possible. Ultrasound. Risk for Down syndrome can be identified based soft markers like small or no nasal bone, large ventricles, and mucofold thickness. Pharmacological interventions. We also have to take note that there is no cure or pharmacological cure for Down syndrome. However, children with Down syndrome would benefit from taking certain medications that can prevent further health problems and complications. So we have anticholinergic. This can be prescribed to control hypersecretion in the airways. Thyroid hormone. Give thyroid hormone for hypothyroidism to prevent intellectual deterioration and to improve the individual's overall function, academic achievement, and vocational abilities. We can also prescribe digitalis and diuretics. This is necessary for cardiac management. Vaccines. Consider pneumococcal and influenza vaccination for children with chronic cardiac and respiratory disease. Consider prophylactic palivizumab, since infants with Down syndrome are at high risk for hospitalization with a respiratory syncytial virus. Anticonvulsants. Administer anticonvulsants for tonic-clonic seizures or for infantile spasms. This is treated with steroids. Next, surgical interventions. So, surgical intervention may be necessary to correct serious congenital anomalies, to reduce atlantoaxial subluxation and to stabilize the upper segment of the cervical spine if neurologic deficits are clinically significant. So we have cervical radiography with flexion and extension views. This should be performed when any neurologic deficit suggests spinal cord compression. We can also have plastic surgery to alter phenotypic stigma. So here is a summary of the whole trisomy 21. This is the pathophysiology of Down syndrome. So the predisposing factors of trisomy 21, again, we have the advanced maternal age, genetics, family history or of genetic abnormalities, chromosomal abnormality, and race. Next, the disease process. What causes trisomy 21? Abnormal cell division during the development of the sperm cell or the egg cell. And after that, we have the three type of Down syndrome, the non-disjunction or the trisomy 21, failure of homologous chromosomes or sister chromatids to separate properly during cell division. For the Robertsonian translocation or the translocation Down syndrome, a certain type of a chromosome becomes attached to another. For the mosaic Down syndrome, mitotic disjunction during early embryonic development of the normozygote. After that, there will be chromosomal abnormalities in the neonate, which results to dysmorphic features and organ anomalies. And because of that, we can see the different features or the different signs and symptoms of trisomy 21, and it is all shown and listed on the screen. Next, when these can be seen in the signs and symptoms, we have the different management or interventions, the nursing management, medical interventions, the pharmacological interventions, and surgical management. So we have the nursing care plan for trisomy 21. We have physiological deficit, imbalanced nutrition less than body requirements, objective cues, difficulty in swallowing, protruding tongue, poor muscle tone, loss of appetite, weight loss. Subjective cues, di siya ganahan mokaon kay maglisod siya, as verbalized by the mother of the client. Wala siya'y gana mokaon, as further explained by the mother of the client. Nursing diagnosis, imbalanced nutrition less than body requirements related to difficulty in feeding due to protruded tongue and high palate. Scientific basis. The body is like a machine that needs to be supplied with the right kind of amount of fuel. This may refer to nutrition or the food requirements of a person or a patient. Adequate nutrition is essential to meet the body's demands. And as you all know, children with Down syndrome can find feeding difficult. The large, protruding tongue and hypotonia interfere with breastfeeding, bottle feeding, and introduction of solid foods. Hence, possible imbalanced nutrition can be experienced by the child. Sources is found on the next slide. Objectives of care, general objectives. After a week of holistic nurse-patient interaction, the client will be able to manifest no difficulty in feeding and will gain weight as evidenced by gaining 1 to 2 kilograms. Specific objectives. After 8 hours of SN patient interaction, the patient will be able to identify ways to promote and ease feeding, obtain adequate nutrition, exhibit no further weight loss. So we have the nursing interventions, measure to promote nutrition and ease feeding. So first, we have to closely monitor nutrition. This is to ensure the client's adequate nutrition and prevent malnutrition or obesity. Assess the client's ability to chew and swallow. This is to be able to identify the client's capability to eat. Provide adequate meals to ensure the needed health, diet, and body requirement of the client. This is also to improve the well-being of the client. When feeding, infants and young children use when feeding When feeding an infant and young children, use small handled spoon. This is to properly feed the client since feeding difficulties occur due to a protruding tongue and hypotonia. So I will just say the evaluation in advance. After a week of student nurse patient interaction, the client was able to gain adequate calories, which is specifically 2 kilograms, essential nutrients, and retained proper feedings. So another nursing intervention, increase fluid intake and encourage foods rich in fiber. Constipation results from decreased muscle tone, which affects gastric motility. Discourage caffeinated or carbonated beverages. These beverages will decrease hunger and lead to early satiety. Provide parenteral fluids as ordered to ensure adequate fluid and electrolyte levels. Next, provide good oral hygiene and dentition. Oral hygiene has a positive effect on appetite and on the taste of food. Promote proper positioning, aids in swallowing, and reduces risk for aspiration while eating. Refer to a dietitian for complete nutrition assessment and methods for nutritional support. Experts like a dietitian can determine nitrogen balance as a measure of the nutritional status of the patient. Next, we can refer to a speech, occupational, and physical therapists when mechanical problems exist, like impaired swallow reflexes. Individual strategies and devices may be needed to improve ability to eat, help strengthen muscles, and improve motor skills. Inform parents that the tongue thrust does not indicate refusal to feed but a physiologic response. This is to raise awareness and help the parents understand the situation. And lastly, provide emotional support to motivate and promote clients' view towards the situation. So we have here relevant pictures of Down syndrome or the trisomy 21. Here are different links that talks about Down syndrome. So I will still be discussing. I am Ms. Dumatis Regine Catherine L. And the next topic is all about Fragile X syndrome. So let's first define Fragile X syndrome. So it is also known as Martin-Bell syndrome. It is an X-linked disorder in which one long arm of an X chromosome is defective, which results in inadequate protein synaptic responses. This inheritance pattern has been termed X-linked dominant with reduced penetrance. It is the most common inherited cause of cognitive impairment and the second most common genetic cause of CI or intellectual disability after Down syndrome. It is the most common cause of cognitive challenges in males. The incidence in affected males is about 1 in 3,600 to 4,000, while in affected females is about 1 in 4,000 to 6,000. The incidence in male carriers is 1 in 800, while female carriers is 1 in 260. Hence, girls who inherit the Fragile X may appear normal, or they may have some degree of mental retardation, but usually to a lesser degree than boys with the syndrome. So what causes Fragile X syndrome? Fragile X syndrome is caused by an abnormal mutation in the Fragile X mental retardation 1 protein gene, or the FMR1, on the lower end of the long arm of the X chromosome. We have to take note that the X chromosome is one of two types of sex chromosomes, as we all know, and the other is the Y chromosome. Women have two X chromosomes, while men have one X chromosome and one Y chromosome. The defect or mutation on the FMR1 gene prevents the body from making an important protein called the Fragile X mental retardation protein, or the FMRP. This protein helps create and maintain connections between the brain cells and the nervous system. When FMRP is missing, signals from the brain may be misdirected. So this causes the developmental and learning problems found in Fragile X. So what are the risk factors? Of course, it's genetics. So a couple who has a child with a congenital disorder or an inborn error of metabolism will be at high risk. Who's a couple whose close relatives have a child with a genetic disorder such as a chromosomal disorder or an inborn error of metabolism, or any individual who is a known carrier of a chromosomal disorder, or any individual who has an inborn error of metabolism or chromosomal disorders. So we have the disease process of Fragile X syndrome. The mutation in the Fragile X mental retardation 1 FMR1 gene. Fragile X mental retardation protein, or the FMRP, an important protein, is being prevented. Connections between the brain cells and the nervous systems are misdirected. Hence, this causes the developmental and learning problems found in Fragile X. What are the risk assessments? Early treatment programs can help minimize the symptoms of Fragile X syndrome, and these include educational treatment, therapy treatment, and medication treatment. Educational treatment, this is to promote the best learning environment of the client. Therapy treatment, to improve their speech language skills, motor control, posture and balance, and help control their behavior. Medication treatment, to treat certain symptoms of FXS, or Fragile X syndrome. So the signs and symptoms of Fragile X syndrome. First, we'll talk about the physical features. Long, wide, or protruding ears. Long, narrow face with prominent jaw or prognathism. Males, enlarged testicles or macroorchidism after puberty. Long palpebral features. High arched palate. Strabismus. Increased head circumference. Hypotonia or poor muscle tone. Hyperextensible finger joints. Transpalmar crease. Pes planus or flat feet. So we have behavioral features. Possible greater delay in expressive language than in receptive language. This pattern may increase with age. Speech delay. Speech may be rapid with stuttering and repetition of words. Short attention span or hyperactivity. Mouthing beyond expected age for this behavior. Hypersensitivity to taste, sounds, touch. Intolerance to change in routine. Autism-like behaviors like social anxiety, gaze aversion, sensitivity to sensory stimulation, and possible aggressive behavior. Next, we have neurological features, mild to severe cognitive impairment, occasional normal intelligence quotient with learning disabilities, anxiety, depression, and rapidly changing moods. So what are the diagnostic tests for Fragile X syndrome? First, we have amniocentesis. This test is usually done between weeks 15 and 18 of the pregnancy. It checks amniotic fluid for for the FMR1 gene. Chorionic villus sampling, or the CVS. This test is usually done between weeks 10 and 12 of the pregnancy. It checks cells from the placenta for the FMR1 gene. And lastly, we have DNA testing. The direct deoxyribonucleic acid, or the DNA analysis for the FMR1 gene mutation causing FXS has greatly increased the accuracy of diagnostic testing using Southern blot analysis with new expanded polymerase chain reaction, or the PCR-based technology, to identify both affected and carrier individuals. This testing also permits prenatal diagnosis. So, what are the nursing diagnoses for FXS? So we have here delayed growth and development related to physical disorders secondary to chromosomal abnormalities. So the developmental delay of a child with FXS can be related to an underlying secondary sensory issue. It can be expressed as attention deficit, hyperactivity, tactile defensiveness, perceptual deficit, and learning disabilities. In general, the child with FXS will develop it at a slower rate than the child who is developing typically and may experience delay in acquiring appropriate functional skills such as independent walking and etc. Fear related to outcome of genetic screening tests. So Fragile X syndrome is the most frequent form of inherited intellectual disability and is also linked to other neurologic and psychiatric disorders. This condition can be genetically passed to children, hence leaving fear to client and client's family. Next, risk for injury related to impaired physical mobility. A variety of body function impairments such as motor delay, musculoskeletal issues related to low muscle tone can highly risk the client from injury. Moreover, the syndrome is closely linked to autism. Self-injury and aggression are also known to be common among autistic people. So, what are the different management? So, the nursing intervention, assess family history, assessing signs and symptoms of genetic disorders, assist with bathing and dressing activities as indicated. Since they have a hypotonia plus planness, hyperextensible finger joints, and other physical features that may affect their activities of daily living, such as bathing and dressing. Provide activities to foster growth and development within the limits of the patient's ability. This is to promote growth and development within the limits of the patient's condition. Next, adapt interventions to meet the patient's cognitive level. Children with FXS have a delayed behavioral, motor, and cognitive skills, growth, and development. Adapting their cognitive level can help them understand the activities they need to do or accomplish. We can also refer client and significant other to the following: speech and language therapy. This is to improve the ability to socialize and communicate. Physical and occupational therapy. This is to help strengthen muscles, improve motor skills, and make daily tasks easier. Next, behavioral therapy. This is to help manage the behavioral and emotional challenges of the client. Next, genetic counseling, to raise awareness about the exact inheritance patterns and options available and be able to help the significant other understand the situation. Special educational assistance. This is to provide appropriate treatment and learnings at client's level of ability. Next, implement behavior therapy to control repetitive behaviors. Next, allow the patient and family to verbalize feelings related to the condition. The nurse promotes a supportive environment by taking time to listen to the patient in a non-judgmental way. And lastly, provide emotional support to the patient and family, offering support for a grieving couple confronted with the reality of how tragically the loss of inheritance have affected their life. So it is important to provide support to these clients. Medical interventions. So there is no medical cure for FXS. However, clients can benefit from early detection and medical assistance in order to develop necessary interventions and future actions. So the first three are the diagnostic tests. We have the amniocentesis, the chorionic villus sampling, the DNA analysis or the genetic tests. So for amniocentesis, it checks amniotic fluid for the FMR1 gene. For the CVS, it checks cells from the placenta for the FMR1 gene. DNA analysis or genetic test, this helps detect the size of the repeat cytosine guanine and the methylation status of FMR1. We also have chromosomal analysis. This may demonstrate a fragile site, a region that fails to condense during mitosis and is characterized by a non-staining gap or narrowing in the cells of affected males and females and in carrier females. We can also have spinal X-ray to reveal scoliosis, um, echocardiography to reveal mitral valve prolapse. Pharmacological interventions or management. There is also no pharmacological cure for FXS. However, children with FXS would benefit from taking certain medications that can prevent further health problems and complications. So we can have the methylphenidate. This is to control hyperactivity and inattention. Selective serotonin reuptake inhibitors such as carbamazepine or the Tegretol and fluoxetine, the Prozac. This is to control violent temper outbursts and central nervous system stimulants to improve attention span and decrease hyperactivity. We also have risperidone or aripiprazole. This is to treat irritability, aggression, and mood instability. We have valproic acid, lamotrigine, oxcarbazepine, or zonisamide. This is to treat seizures. So there is no surgical cure for FXS. However, surgical intervention may be necessary to correct serious congenital anomalies. So here's the whole summary of the discussion. This is the pathophysiology of Fragile X syndrome. So let's start with the risk factors. Again, the genetics. A couple who has a child with a congenital disorder, a couple whose close relatives have a child with genetic disorder or chromosomal disorder or an inborn error of metabolism. Any individuals who is a known carrier of the chromosomal disorder or who has an inborn error of metabolism or chromosomal disorders. So if you are risks, there may be a possible mutation in the Fragile X mental retardation gene or the FMR1 gene. And then the Fragile X mental retardation protein or the FMRP, an important protein, is being prevented. Hence, connections between the brain cells and the nervous system is misdirected, which causes the developmental and learning problems found in Fragile X. So the following signs and symptoms are seen on the screen. I divided it with physical features, behavioral features, and neurological features. So when we have Fragile X syndrome, we can do different or the following management: the nursing management, medical interventions, pharmacological, and maybe surgical management to correct serious congenital anomalies. So it's all listed on the screen. So we have the relevant pictures of Fragile X syndrome. And I also provided different links for you to watch about Fragile X syndrome.